Hello, I'm Rebecca Shenalue, the Cancer Support Program Coordinator here at Enloe Regional Cancer Center. Welcome, and thank you for taking the time to watch these new patient welcome videos. These videos will help you know what to expect and give you tips so that you have the best possible experience when you're here at Enloe Cancer Center. Invite anyone who might be involved in your care to watch the videos. It will help you all be on the same page. And also remember that you can pause the videos or watch them more than once. My guess is that since you heard the word cancer, even if you look calm on the outside, at some point, some part of you has been going, ah, this can't be happening. What am I going to do? Patients often describe this time of not knowing what's going on and waiting to start treatment as the hardest part of their experience with cancer. Everyone handles it differently, but we know from research that when you have the information you need, you gain a greater sense of control, and that relieves anxiety. In the days and weeks to come, you will feel more assured as you gain clarity and understanding about your diagnosis and how it will be treated. One of the things you can do now to feel more in control is to be prepared for that first visit with your oncologist or surgeon. In this video, I will introduce you to the healthcare team and what they do, and we'll review some things that you can do to be prepared for your first appointment. As soon as we get a referral from your provider, you will hear from our new patient coordinators. They will work with the office that referred you, with pathology, with imaging, and they pull together all the necessary information the doctor will need when they see you. They also send you an intake packet by mail or email for you to read and complete before your visit. You can call the new patient coordinators with any questions you have about the intake packet or about your referral. They are super helpful. Your first appointment will be with a medical oncologist, a surgeon, or a radiation oncologist. But whenever you come to Enloe Regional Cancer Center, you'll be interacting with a whole team of great people. There's a Your Care Team sheet in your intake packet, and it will introduce you to your doctor, and we'll also talk about some of the other professionals who will be taking care of you while you're here. Take a look at that sheet so that you feel more familiar with the team and to know more about who will be doing what. In your packet is a list of possible questions for your visit. Your initial appointment is usually 45 minutes to an hour long. Look at the question list before your visit and highlight the ones that are most important to you. And take that with you so that you remember to ask your most important questions first. Hopefully you'll have time to read the intake questionnaire form and complete it, bring it to your first appointment. If you're already an Enloe patient, we may have some of this information, but this is a good opportunity for us to be sure your information is up to date. If you're already using the MyChart patient portal, you can update your personal information, your insurance information, and your medication list there. Whenever you have an appointment at Enloe, completing the information in MyChart first can make your check-in time shorter. We'll talk to you more about MyChart in video number 3. Occasionally, we get people scheduled for their first appointment so quickly that the intake packet does not have time to arrive in the mail. If this happens, don't worry. We'll go through the information when you arrive. You do want to bring an up-to-date medication list with you, or just bring all of your medications so that the doctor knows exactly what you are taking when talking with you about the treatment plan. Before you come to your first appointment, think about who might be a good person to be with you during your first appointment. This person may be your spouse, but you may also want to ask someone else who might be better for the job, like your overly analytical sister or your friend who already works in healthcare. Pick someone who can best help you take notes and ask questions at your first appointment. who will gather additional information with you after your visit and who will be supportive as you consider treatment options. Just a reminder that anyone sitting in your appointments will be hearing intimate details about your health, so pick someone that you feel comfortable with. This is also a good time to decide which family or friends to list on your medical information release, which is included in the intake packet. This form lets us know who we can talk to about your care. You get to choose. These days, patients and providers might do a telehealth visit instead of meeting in person. Whether you meet by MyChart, telephone, or in person, your doctor's medical assistant will be able to help you determine what will work best so that the people that you want to hear the conversation with your doctor can be included. Lastly, let's talk about what you'll need for that first appointment. We'll talk more about help for understanding your insurance in video number 4. But here's the list. Bring the completed intake questionnaire form if you have it, and a medication list, along with your medications if you think there'll be any questions. This include on your list over-the-counter medications and supplements too. It's helpful for your doctor to know about those. You can bring the completed and signed outpatient medical release, the sheet that has your questions for your doctor, a photo ID, an insurance card, and if you have an advanced healthcare directive or a POLST, bring that and we'll get a copy of that scanned in. Lastly, bring a laptop computer or a pen and paper for taking notes. Be prepared. It's the Scouts motto, right? Taking the time to prepare for your first appointment will help you feel stronger and more in control. For more information about what to expect at your first visit, watch video number 2, Your First Visit. Thanks for watching.